Good morning. A warm welcome to you to this latest COVID-19 update by the Ministry of Health here in Barbados. As you are well aware, we are at a stage now where we have to live with COVID, and that we have been doing for quite some time now. However, in that context, you recognize that there are times when COVID will be high and there are times when it will be low. We've been through a period where it was being controlled and came down, but now something else seems to be appearing. We have with us the Chief Medical Officer of Health, Dr. Kenneth George, also from his ministry, Dr. Arthur Phillips, and Dr. Adana Grandison. And we're going to begin with an opening statement from the Chief Medical Officer of Health. Dr. George.
Good morning, Barbados. It's good to be here. I think that I take this opportunity, the team is taking this opportunity to report to the nation on the situation with respect to COVID in Barbados. As you know, the Ministry of Health has been in the forefront of trying to manage this situation, but we have also indicated that the public has a significant responsibility as we try to open up our economy and open up the country. And therefore, the theme of this message and the theme of the press conference should be seen as personal responsibility is the way to get us out of our current situation. I have a prepared statement. The Ministry of Health and Wellness wishes to report that following a decision of the coroner's office to carry out COVID testing of persons who died suddenly in communities across Barbados, the total number of COVID-related deaths in Barbados has increased. The positive results were obtained from tests carried out by the coroner's office on the suspicion that their sudden demise may have been attributed to COVID-19. The policy of the coroner's office is to rule out COVID-19 as a likely cause of death, since autopsies cannot be performed on persons who are known to have died from or with COVID. The test results from the coroner's office has identified an additional 43 COVID-related deaths, which have occurred within the last 6 months. These persons died in communities across Barbados before being tested or assessed with appropriate care. The total number of COVID-related deaths, therefore, as of the 28th of March, stands at 374. It must, however, be noted that in all cases, the primary cause of death may not have been COVID, but this diagnosis was found at the time of death. The Ministry of Health and Wellness is seeking to provide the public with the most accurate information as it relates to COVID-19 to ensure that we can make informed decisions about our health. Thank you.
Thank you. Yes, Dr. George.
So, thanks. And just reading off script, from time to time, if there is an unnatural or unusual death within the community, these persons have been tested for COVID. Some of the causes of death are not related to COVID. So, for example, there was an individual who had a gunshot wound and was tested for COVID. But you would imagine that this individual, his immediate precipitating event for the cause of death would be the gunshot wound. And there have been a few cases with respect to these numbers that I have reported, but I just wanted the public to know that with respect to clarity of information, that these extra deaths are being put in the public space. We had to collate them to make sure that there was accurate information. We also had to do some internal checks to make sure that these were indeed positive from the Best DeSantis Public Health Laboratory. Thanks a lot, David.
Thank you. And next we are going to hear from Dr. Arthur Phillips. Good morning, Dr. Phillips.
Good morning, David. Good morning, Barbados. Many of you may have noticed in recent times that we've been having an increase in the number of COVID cases locally. While the numbers are not high, we are certainly monitoring the situation. And what is most important at this time are our individual and our community measures to control spread. The core metrics that we use to monitor transmission all appear to have reduced their decline and are trending in the same direction. So, for example, the new cases for the week ending March 27th are 40% higher than for the previous week, and the R effective, or the average number of cases generated by each person, is 1.35. So if you have 100 cases, we would expect that you would get 136 more cases following. The 7-day positivity average rate has increased from 12% to 15.9%, and the prevalence, so the number of persons in the community, the proportion of the population who have active COVID infection, also appears to be increasing. So these increases that we're seeing could reflect increased transmission due to factors around increased effective contact between individuals, as well as there may be changes in the infection that is present. We're aware that Omicron had been confirmed as being in Barbados, and certainly what we're seeing around the world now is that the BA2 Omicron subvariant is dominant in our source markets. We have selected samples which will be tested by CARFA to facilitate sequencing and confirm the current variant situation in Barbados. I also want to take this opportunity to let you know that while BA2 is more transmissible than the original Omicron, current evidence indicates that it does not make people sicker than BA1, and of course BA1 was considered mild, particularly when compared to the more severe variants like Delta. Additionally, available data suggests that reinfection with BA2 after BA1 is rare, and that the available vaccines continue to have effectiveness against BA2. So living safely with COVID doesn't mean ignoring the virus and hoping it will go away. In our current context, transmission levels continue to be very high. The 28-day cumulative figures are above 500, and therefore a major factor in terms of what happens going forward will have to do with how we respond to what's happening currently. So the measures to protect ourselves against poor outcomes, particularly in terms of severe illness and death, remain the same. The hand washing, the physical distancing, the isolation, vaccination, these all continue to be important, and I encourage everyone to do their part in reducing the risk of infection to themselves and to others. I thank you.
Well, Dr. Phillips, if you look at the news, we hear that several countries seem to be having an upsurge in this BA2. And I'm sure there are many people who will be asking the question, what exactly is different about this one, this particular variant or subvariant?
Thanks, David. BA2, what is most significant and most important at this time in terms of BA2 is that it is more infectious than BA1. It is mild, but just as we would have said with BA1, even though something is mild, it can still result in significant negative impact if we allow it to run rampant. So we still need to do our part in terms of managing the risk of spread.
And what are the symptoms? What should people be looking for? Are there any differences between this and the first wave of Omicron?
The symptoms are symptoms of viral illness. So individuals should consider being tested once they have evidence of a viral infection.
Okay. Dr. Grandison, do you have anything to add?
I think that Dr. Phillips really summed it up quite nicely. Good morning, everyone. Certainly, the vaccine has been shown to work. 72% coverage and reduction in terms of the chance for infection, and 90% chances for persons developing severe disease and requiring hospitalization. We would have seen that our numbers for hospitalization during the Omicron wave in comparison to the Delta wave would have been lower. And that is quite reassuring in terms of what we know about Omicron. And as Dr. Phillips would have stated, certainly the persons who may be exposed to BA2 and would have previously been infected with Omicron are at a reduced risk of actually contracting BA2 disease.
Well, let me say to you that this is supposed to be a two-way interaction. Therefore, it's not just the officials of the Ministry of Health speaking to you, but we want to give you the opportunity to raise your ideas, your concerns, so that we would be in a better position to assess exactly how things are going as it relates to dealing with COVID-19 at the moment. In that regard, we're going to take your questions, questions from members of the public via the number that has been given, 256-1023, and we're going to come via Zoom to some members of the media who would naturally have various questions that they want to pose to these public health officials. So let's go to the media first of all. Good morning.
Good morning, everyone. Dr. George, Mr. Ellis, Dr. Phillips, Dr. Grandison. I have two questions, one for the Chief Medical Officer and one for Dr. Grandison. And for Dr. George, my question is, Dr. George, over the last 3 weeks to a month, we've seen the numbers fluctuate, but for the last 3 weeks more so than not, we saw the numbers go down. But we also saw the number of tests done by the Best Dos Santos laboratory go down as well. So my question is, after hearing over the last 2 years, the more you test, the more infections you find, were the reduction in numbers a fair representation that there was a lessening of infection in the Barbadian community, or was there a lessening of community spread, or were those numbers strictly a percentage of the numbers that were tested?
Okay, I can. Yeah, I can take the question. Thanks so much for that question, Barry. The numbers tested give us a sense of what is happening locally. You are correct in that what we've seen is that the incidents would have decreased probably out to around the 20th of March or so, and then sort of leveled off and has started to trend up again. This is the importance of using multiple metrics. So we don't look at one number to give us a sense of what's happening, and that's what we've tried to do in sharing the summary this morning, so that we have absolute numbers, we have percentage positivity, we have numbers of cases linked to other cases to get a sense of what percentage spread or increase or decrease are we having in terms of numbers of persons infected by any one person from our contact tracing and the reports of individuals as to why they're testing. We have all of these factors that we pull together to then say, okay, what is the situation saying to us? So yes, we know that the absolute numbers in terms of testing will tend to fall as people may feel more relaxed, as the cases go down. People may have a lower index of suspicion in terms of testing themselves or agreeing to be tested. But those other figures, so what percentage of the cases that were tested are positive, and what's happening with the issues of why people are testing. So we put all of those together to give ourselves a sense of, okay, it seems like things are trending up again. And as we said, this is consistent across the indicators that we monitor and that we're reporting on. So we think it's reasonable to say that this is not distorted or an artifact due to reduced numbers. Yeah. So again, thanks for the question. I think it's a very important question and something that people should give thought to. Thank you.
Let's take, yeah.
Dr. Phillips, then, based on what you just said, when the Ministry of Health and Wellness looks at all the metrics you just mentioned, can you tell the public of Barbados if the needle has moved with regards to community spread in Barbados?
So, thanks for that question. There is community spread in Barbados. We never indicated to the public that community spread in Barbados had stopped. And what we have seen is an uptick with respect to new cases. And we look at several metrics, including the epidemiological curve, and it was coming down nicely. But within the last 10 days, there was a leveling off and a slight uptick. And this is important. Why? Because we are in this for the long haul. I think we have moved away from public health measures such as curfews and lockdowns. And therefore, the approach that we are taking is living with COVID. And therefore, we have given you the tools to live with COVID safely. And that is the major takeaway, living with COVID safely so that the economy can continue to churn. From time to time, unfortunately, there have been deaths. And this is an extremely sad state of affairs. But for the majority of us, if we use the tried and tested rules, we can still beat this. I am happy that schools have reopened. We continue to work with the Ministry of Education, and we actually meet them on a weekly basis to look at reports and discuss challenges as they come up. It is important that if we're going to return to some normalcy, that sports needs to start back into Barbados. And I'm a supporter, I will say, of cultural events starting in Barbados again. However, it must be done in a situation understanding risk and making measures to protect yourselves. As we have indicated to the public, the Ministry of Health and Wellness is here to hold your hands and to guide the process. We will continue to do so. However, we are again appealing to the public for their cooperation. Our vaccine rates are about 66% of the total eligible population that has been vaccinated. And again, the appeal is for persons who haven't been boosted to go and get boosted, and those persons who are still sitting on the fence to again consider not only yourselves but your friends, your co-workers, and your families to make sure that you protect yourselves and also those groups. So from a public health perspective, we're going to manage this, but we are going to be in this for the long haul. As Dr. Phillips has clearly indicated, on the horizon is the new virus, the new form of Omicron, and from information we have had, it is up to 50% in some of our source markets. and people move on planes. So although there are protocols still in place at our ports of entry and will continue for the foreseeable future, there will still be leakage at your borders. And therefore it is you can't physically block a virus from entering your country. What you can do is take mitigating measures to prevent quick spread and also to prevent the burden of that disease. Thank you.
Dr. George, you called for cooperation. You make an appeal for cooperation. So what is it that you are seeing out there in the community that is driving this particular appeal?
So there are multiple things. I think, David, as you know, people are tired of COVID fatigue. Mask wearing is not universal. There has been no change with respect to the mask wearing policy from the Ministry of Health's perspective. Masks offer the best possible protection for you and your families, and therefore it is a requirement. I think that people have relaxed, and we know that there's no curfew, so things are happening probably unbeknownst to the COVID monitoring unit. Small unit, they can't be there every place. We had a recent cricket English tour, but we have to find a line to walk somewhere in the middle of the road where liberties will not be trampled on, but public health will certainly play an important role in managing where we go.
Let's take another question from the press.
David, I have a question for Dr. Grandison. My second question, and we didn't get to it. Dr. Grandison, there are many Barbadians who would have received their first vaccination shot in February, and they would have been boosted. They have gone for their booster shot sometime between September and October. It is now March, so in many instances, the people who got their boosters right on time around September, October, 6 months have now passed. Can you give the public an indication as to how that booster shot given in September, October would be able to fend off the virus if someone to become infected now, 6 months later?
Thank you very much, Barry, for the question. I just want to make sure that I'm understanding you clearly. You would have stated that they had their first shot, followed by the second shot, and now a third shot with a booster. That's correct?
Correct. So let's take me, for example. I got my first shot in February. I got another one, the time frame that was supposed to happen then. And then I got a booster shot in October. Since that shot was given in October, virtually 6 months have passed. This is March 30th.
Could I speak?
So with this new variant of Omicron having been identified, but that booster shot given in October, has the research shown that that does a good fending off this particular that has been recently identified as a significant variant?
Sure, it's a very good question. What I will do is allow, first of all, our C.M.O. to comment, and then I'll come back and comment for you. Not a problem.
So I think you're getting at the issue of the second booster.
Because there was only one booster given, Dr. George.
There is the second booster. You were given a first booster, which is given by universal to Barbadians. And then recently, there is some evidence to suggest that a second booster may be effective. I think the FDA is to make a pronouncement later this week with respect to the second booster. We are not there yet in Barbados. We always purposely follow what's outside in the international space. I know that Israel has gone ahead and done second boosters to its population. But remember that we take and we look at the evidence and guidance from our international partners also, which tends to be the WHO or World Health Organization. So things may change over a period of time as we know more. And it has been put in the public space that you require boosters on an ongoing basis. I'm not so certain, but once it becomes a bit more mainstream, we will certainly have options for the Barbadian public. Thank you.
Here's a related question which has been sent, and this one has been sent by a doctor who asks, can we get an explanation as to why fully vaccinated persons are dying? Are these persons boosted? When were they last vaccinated? And then the person asks, should we stop using the phrase fully vaccinated? How do you answer these questions?
Right. So, Adana, you want to speak on that?
I will actually comment, because I think Barry was talking about the fact that he was boosted with the third dose. And yes, Barry, to answer your question, you are covered and you are protected with 3 doses, even though you're 6 months out, if that is the question that I think that you are getting at. JAMA actually produced a recent paper that actually shows that persons who have been boosted, and this is with the 3rd dose, so they've had their first 2 courses and they're now going back for their 3rd dose, that they actually had lower chances of presenting to hospital. And that is what we're really trying to prevent in all cases, ensuring that persons do not get very sick, that persons do not overwhelm our healthcare system. So the research is out there. It is actually showing, CDC also brought out data actually showing in real life studies that the actual 3rd dose booster, and as Dr. George would have stated, with the 4th dose on the horizon, there are some countries that have started to use the 4th dose as an additional way of providing additional protection. But we are still looking at data, and we will continue to examine data and see what is best for our country.
Can we get another question? Is there anybody else within the media who has a question? Yes, go ahead. Oh, the questions that I raised. Yeah.
So you raised the question why people who are vaccinated are dying. And let me be clear, we never said vaccines stop deaths. And indeed, if you look at the situation, we will have deaths in the vaccinated and unvaccinated group. That's clear. Vaccines don't stop deaths. What they do is they give you a better chance, and your outcomes tend to be better, and your death rates tend to be better in the vaccinated population. Initially, the persons who were unvaccinated were taking the significant burden of deaths in Barbados. That has changed a bit. Initially, it was 90%, 10%. Now it is about 70-30 with respect to unvaccinated people and vaccinated people. And still we have the data to suggest that death rates and poor outcomes are worse in the unvaccinated group. Those are just the facts. I can't change that. What I will say is that you will get deaths in both groups. In addition, you must be aware that many of the deaths are occurring in persons in their 80s and 90s. And those individuals, even if they were vaccinated, would have compromised immune systems because of their age. So that's my response to that caller. Thank you.
Okay, we'll take another question from the media. Hello. Good morning. In the meantime, the person identified as Jeffrey is asked to mute their mic. Thank you.
Outside Walker CSD.
Is that a question for us, or is that a private conversation taking place? It's difficult to, and it's not clear. It's off mic, and you can't. The person needs to get closer to the microphone if it is a question for us. And please identify yourself. In the meantime, Dr. George, this whole question of what we've seen as this uptick, as you describe it, what do you see as the possible implications for business community in general, and of course the fact that we have reopened schools? How do you see that impacting on those two situations if this uptick continues?
The challenge of working in the COVID environment is that there always have been so many unknowns. And therefore, it's difficult to say, but as I have repeatedly said, the issues of curfews, lockdowns, closing of our airport, etc., were early in the pandemic. And it was probably good public health measures to attempt at that time. But what we have tried to do with some success in Barbados is tailor our response to the situation at hand. We need to be flexible, we need to be adaptable. And we will continue to do that. We need to be, as the Prime Minister had indicated, accelerator and gas, but we are not going to return to, accelerator and brakes. We are not going to return to situations where there are going to be lockdowns and persons' movement. You are well aware that many countries are trying different things. In the United Kingdom, they have removed most of their public health measures, and different countries have done different things. You're aware that in Shanghai, in China, that they are having a very, very large outbreak at the moment, and there is significant curtailment of movement of various individuals. So it depends on the country, how the country views the information and the steps that they take to protect persons and their communities. Thank you.
Thank you. I'm putting out a request to the members of the media. If you are not asking a question, please mute your mic because it is creating a bit of a problem for us. Let me come to the media now for a question. Hello?
Good morning. Lisa Broom from CBC. Just a question from me regarding the Easter camps. The schools are preparing to break for Easter, and some prospective and camp leaders are asking what is happening. They're saying that they're trying to get answers on what's happening if camps will be allowed. Can you answer that? Any of you there answer that?
There's no restriction on camps, Lisa. Did you hear me?
The answer was that there was...
There's no restriction on camps. The COVID protocols need to be followed.
Oh, yeah, because we've actually had some camp leaders saying that they've been trying to get through to the COVID unit to get answers on whether they can go ahead, but they've not been hearing anybody or anything.
I'm again asking the members of the media who are not asking questions to mute their mics because your private conversations are coming through. Thank you.
Yes, Lisa. Camps can go ahead. The protocols will remain in place. There's no restriction on summer camps or Easter camps. Thank you.
And these restrictions would be things like distancing, wearing of masks in close proximity, those types of things, yes?
Absolutely. So mask wearing should be observed at all times. And physical distancing of 3 feet is currently in operation.
Thank you.
Okay. Dr. Phillips, it's been quite a while since we asked for your input. Quite a lot has been said so far. What are your thoughts on any of what has been stated? What do you have to add?
Yes, I think the issue of caution and balance is important. I think we're fortunate to have come through a really major negative impact of COVID with Delta. We've adapted and adjusted our measures to deal with that, and I think we're now in a place where collectively, as individuals, as communities, as a health sector, we have a lot of experience and we have a greater level of comfort in terms of our ability to assess and adapt to the threats as they may come. We will have to make some adjustments over time depending how things go. I think the purpose of this morning is just to highlight or to flag or to verify for individuals who are saying it looks like. So we're saying yes, it does look like there is an uptick. We are not signaling any change in measures at this time, but we are saying to individuals, do your part, manage your risk, manage the risk of those that you have responsibility over, the section that you may have control over. Try to manage the risk in that area. And certainly, as C.M.O has said, if things change, then there may have to be consideration of adjustments and measures. But certainly at this time, there is no call from the health officials for a change in the measures, but we are asking individuals to ensure compliance with the measures that are currently in place. That level of awareness and responsibility being your brother's keeper.
This person wants to know what is being put in place for positive cases in the schools. Who's taking that question? What is in place?
I can speak to that. C.M.O would have mentioned that their weekly meetings. This has come out of fairly intense technical meetings between Ministry of Health and Ministry of Education. We have a good relationship with our colleagues in Ministry of Education, and we've been able to have the weekly meetings, which then look back at the measures and make any fine adjustments that we need. But in short, Ministry of Education has access to support and guidance from Ministry of Health, and there are agreed procedures. What I do want to flag, and what I think is very important and commendable in relation to how Ministry of Education has been managing, is that where we have had cases, and we have had a few cases, where we have had those cases and we investigate, the transmission that we find that is most likely to be the source of the infection has been outside of the schools. We have not had situations where there has been propagation or spread of COVID within the schools, but we have had cases detected at school imported from the community or other settings. So I think the measures that we have in place in terms of the agreed protocols, as well as the mechanisms for communication between Ministry of Education and Ministry of Health, I think give us a level of comfort that we are trying to have the appropriate health measures in place while ensuring that our children have access to face-to-face learning as much as possible to maintain their social and academic progress.
Now, we are having some problem with Yolan's Galaxy A10, where noise is seeping through from their conversation there. So I'm hoping that they will address it. Now, here's a question which asks about this particular. Really, this is a bit difficult to continue with, given the interference that we are getting there. Thank you. This person talks about camps, churches, and schools, etc., being asked to follow the necessary protocols, but yet we've all been seeing people having parties and events, not wearing a mask or even following protocols. To me, it seems like double standards. That is why we are confused. How do you respond to that concern, Dr. George? the perception of...
I have spoken about this issue already. The ministry is not guided by double standards or tries to promote double standards. There's a section of the population who will always comply. There's a section of the population, regardless of what you do, will not comply with any directives. So that's the challenge. We haven't given up, but that's certainly the challenge, that there will always be individuals, despite knowing what is the correct thing to do, will seek to break the law. So we need to continue to work on that. The issue of double standards is, however, refuted.
Of course, there is, you began by speaking about community deaths, and I'd like you to explain for members of the public who, either if they can't get through now, but perhaps will be looking at this later, explain what are the challenges that you've had in trying to get this kind of information earlier, because you've given a number of 43 deaths, I believe, over a 6-month period. So explain what that challenge has been.
Thank you, Ms. Ellis, for the question. So the process of actually ascertaining a positive test at the post-mortem period for a person is done as a measure that was implemented by the coroner's office. Certainly the Office of the Coroner, as well as the Ministry of Health, there is a duty to ensure that, one, the information is accurate, and two, that the information that's communicated on the death certificate is as accurate as possible, not simply to ensure the proper closure of the family, but also to ensure that in terms of public health documentation and record keeping, the information is as accurate as possible. This information sometimes helps us to be able to implement further measures at a later time. And so after audit and making sure that the information is as accurate as possible and that persons are having their death certificates documented as accurately as possible, then we compile the information and would submit it for representation to the public.
So that would also raise the question of what we see as the way that the system is operating that could be tweaked, could be improved.
Yes, so certainly with everything COVID recently, we have noticed that it is important to be able to be nimble. Even with the home isolation program, we have noticed the importance of being able to move from semi-manual in some cases to being fully automated. And this is certainly something that has been in discussion between Ministry of Health, Coroner's Office, and the Attorney General's Office. And we can always ensure that we try to minimize delays and also ensure that persons are getting the information accurately documented and presented for their families. So there's always room for improvement. Absolutely, I completely agree with you. But at this point in time, we are ensuring that accuracy is paramount. So to the extent where we have to ensure that this information is correct, that's what we would do.
Do we have another question from the media? Again, appealing. Yeah, go ahead.
Sorry, this is Lisa Broom again. I have another question relating to the uptick that has been noticed in the community. I'm wondering if there have been any trends discovered in those numbers, or when there were the huge numbers, you were talking about clusters here and there, but have you noticed any trends given the uptick that we're seeing?
Sure.
Phillips,
Thanks for that question. What we can indicate at this time is that the demographic trends and the geographic trends have not changed. So we still have distribution across Barbados, concentrated particularly where there are higher densities of population. And the other characteristics in terms of male, female, age, etc., there have not been any significant changes in those at this time.
Next question.
First, on myself, last year, you would have said Barbados would have done its due diligence in trying to find vaccines for young people under 12. Can you give us an update of how that is going?
Barry, we're still trying to source vaccines as we speak. What we have taken a decision first that we are going to bring vaccines to the schools. So with parental consent, we are going to have vaccines for those individuals 12 and up who will be offered the vaccines. We are planning to do this on a school by school basis. As I said, it is voluntary. Parental consent will be required. With the smaller age groups, we're still trying to source the vaccines. We have gotten some promising leads, and once we have vaccines here, we will certainly make sure that there's a program to roll out quickly. The good thing about it is that throughout this pandemic, children have had better outcomes. And it is certainly, there's evidence to suggest that children are not the best in transmitting the virus either. So that works in our favor, but we are going to continue to pursue this as a matter of urgency. But while speaking on this topic, I think that from a public health perspective, I must use this opportunity to let persons know that our vaccine program is alive and well. What we have noticed is during COVID that there has been some drop off in the vaccines that we typically offer children, that we have been offering children for years and years, quietly in the background to make them safe against measles, diphtheria, rubella, etc. And I want to use this platform to urge parents to make sure that their children's vaccination record is up to date. There's a green card or a green book. There's schedules for vaccination. The polyclinics are open. We are certainly doing, because of the volume has decreased with respect to COVID vaccinations, we're slowly shifting our responses from the peripheral sites back to the traditional polyclinics within your catchment. Polyclinics are open. Nurses have returned in full force. So therefore, use the opportunity, not only for COVID, but use the opportunity to get your children vaccinated for the following: measles, mumps and rubella, hepatitis B, Haemophilus influenza, diphtheria, tetanus, and that's it for children. So make sure that you interact with your primary care. Those who do not wish to go to polyclinics, go to your private sector. Pediatricians also are very available to give the standard vaccines that we have been offering for years on end, and make sure that your child's vaccination status is up to date at this point. Thank you.
And explain why important. Hold on a minute. I think it's important to explain why this is so important.
Well, for children and from a public health perspective, I would prefer the children to be vaccinated for measles, mumps, rubella, and those types of preventable diseases before COVID. As I said, children have better outcomes and better responses during the COVID pandemic, and they are not as effective transmissions of disease. So I would like the public to know that it's important that we don't only focus on COVID. This ministry is working on its agenda. We are trying to broaden out. We're trying to work on some critical issues with respect to nutrition and NCDs, etc. And we need to during COVID, a few of the public health issues were probably neglected, but we're trying our best to come back to our core functions and to make sure that we do COVID well and we do other public health functions well, because that's the situation we need to get to. We can't be a one-track ministry. Certainly in the acute stages when we were in the trenches, that was the required response. But at this point in time, we need to get on to with other important functions that will make sure that our population remains safe. And one of those functions is early childhood vaccination.
That's Barry Allen.
Yeah, Dr. George, just a follow-up to your information that you just gave us about starting in the schools and with parental consent. Can you give us a frame of how soon you expect to get that started, or has it already started?
Barry, we will make that in a separate announcement. I just let you know that there has been meetings with Ministry of Education, the vaccine team, and we are close to rollout.
Well, Dr. George, one of the stronger points in the vaccination program had to do with taking it to the community. To what extent is that being contemplated?
There is still community vaccinations available. We do it in specific cases. We have our vaccine bus that still is operational, which goes into the communities for people who are either immobile or can't access care. We certainly provide those services, and that will continue. But for the majority of us who are ambulatory, etc., we can't provide house-to-house services, and therefore you will have to access primary care services. Fortunately, with respect to the vaccine program, we have broadened that to many private practitioners, and therefore there are several private practitioners who have come on board during COVID to give options to the public with respect to where they can receive vaccines. So it is certainly not limited to government, but there are several private providers who do vaccinations, and I'm just letting you know there's no cost to you when you interface with a private provider to get COVID vaccines. That's free of cost. So it's just another option for individuals to access care.
I suppose this one should go to Dr. Grandison, where this person says, I'm hearing talk of a correlation with HIV and the COVID vaccines, and they're curious to hear some info on that. Is that another piece of the misinformation or disinformation?
Thank you very much, Mr. Ellis, for that question. It is very much part of the mis and disinformation that is out there. I have not, in the research that I have done, and I don't know maybe if Dr. Phillips has seen any of that, or even Dr. George, but certainly from looking through all of the journals and the many updates that I get daily coming to my phone, I have never come across any correlation. I know some persons may possibly think that because both of them are viruses, that there is an automatic link, but certainly that has not been substantiated in the research that has been done.
Okay, thank you very much. One more question from the media, if there are any others.
I have a quick question, Dr. George. Can this drop-off that you spoke of in terms of parents in Barbados getting the other vaccinations for children like MMR, do you think it's correlated to the COVID-19 fatigue? Is this part of that? Why would they suddenly stop seeking those important vaccinations for their children that have been for 50 years?
I don't want to speculate. It is what it is. That will be speculative. What I would say, though, is that we knew during the heights of COVID, persons were not accessing primary care services as before. And that is for whatever reason, they were not accessing primary healthcare services as before. And why we know that? We're seeing many more people with NCDs who are uncontrolled and in a bad place because they haven't gone out and done the basic preventative type measures that are required. So it is an issue that we are willing to look at, but as I said, it's multifactorial. I don't want to speculate, but the facts indicate that the traffic through our primary health care has reduced. And I would imagine that private physicians also notice that type of decrease in their traffic. But I would like the public to know that preventative medicine is still the bedrock of public health. And therefore, I encourage those persons, particularly with non-communicable diseases, and children to get their other vaccines to interact with either the public or private system to make sure that they're up to date and they have their checks.
Okay, well, as we close off, Dr. Phillips, you started off on the general picture, and I'd like you to basically summarize for the public your concern, and then I'll ask you, Dr. George, to do likewise as it relates to what you put on the table.
Thank you, Mr. Ellis. So what we've said today is that we are confirming that there appears to be a sustained increase in the COVID activity locally across a range of metrics, including case numbers, percentage positivity, and the trends, the doubling time, etc. And this is something that we're monitoring closely. We have selected samples for testing for BA2 to verify whether it is here or not. We are encouraging individuals to continue to keep their guard up and to maintain the measures for themselves and in spaces where they have responsibility. So masking, sanitizing, distancing, vaccination. Please continue to do your part, and we will continue to do our part so that we are as safe as is possible. Thank you.
And Dr. George?
So David, I'm going to hand over to Adana, the only lady in the house, to make some closing comments. I think I've spoken a lot, and I just would end with this, that we continue to rely on the public for your cooperation. We are here to help under all circumstances. Thank you.
Thank you very much, Dr. George. Yes, certainly, I think that this is an opportunity, if we've not done it before, while we may be tired, while we may be fatigued, to really not let our guard down. Yes, we are moving towards a new normal. We have been through this now. We are approaching really 2 and some years. And it's really an opportunity for us to continue to maintain vigilance, be very aware of yourself. If you have concerns in terms of you are noticing those viral-like symptoms that Dr. Phillips would have spoken about, even if you think that you may just have a simple sinus infection, because I know that's how some persons will present to us and say, you know, I just didn't feel well, or I had what I thought was a sinus infection, a sinus drip, a postnasal drip. Go know your status, and I don't think that persons should feel in any form or fashion that there needs to be any stigmatization associated with COVID. This is a virus that anyone can catch. We are all susceptible. We are in this together, and I think in an attempt to ensure that we do not suffer some of the changes and deficits in quality of life as it may pertain to things like long COVID, I think it is important that we continue to ensure that we maintain the non-pharmacologic interventions. And for those persons who can get vaccinated, please do. Thank you.
And by non-pharmacologic, you mean?
I mean your mask wearing, I mean your hand washing. I'm talking about that physical distancing. Quite often, our hands are the villains of our body. They certainly take virus all over the body, and quite often we put it to our eyes and our mouth. So I'm going to ask that pay more attention to those non-pharmacologic inventions to make sure that we continue to protect ourselves during this time.
Thank you very much, Dr. Adana Grandison, Dr. Arthur Phillips, and Dr. Kenneth George. And let me also thank the members of the media, members of the public, and the technical team for assisting us in this COVID-19 update. I'm David Ellis. Do have a great afternoon.